All right, so this is the third video in the series, and at this point, Mr. Rudd has been successfully weaned to an SIMV rate of 4 breaths per minute, and the physician has requested a spontaneous breathing trial due to the multiple failures of extubation in the past. So, first thing I'm going to do before I start an SBT is talk to Mr. Rudd about what that is and what we're going to be doing. So, Mr. Rudd, we're going to be starting a spontaneous breathing trial. What I'm going to do is switch your ventilator to a mode where you are doing all the breathing your own. You're working all on your own. The ventilator is going to be very little help. It's just going to give you enough to overcome that tube that you'll be breathing all on your own for the most part. But don't worry. I'm gonna start when you're ready, and I'll be here for the whole time to coach you through it. And we're going to get through it here together. And after the trial, we're going to get that tube out. So after I tell him exactly what we're going to be doing, I'm going to go ahead and put him on that mode, which the mode I'm going to do is going to be CPAP plus pressure support. And the values I'm going to do is 5 and 5, 5 of PEEP and 5 of pressure support. CPAP is continuous positive airway pressure, so it's going to continue to give him airway pressure, so he's overcoming a little bit of that work of breathing that he's getting some of that air. But the pressure support's the big part in this, that it's going to help him. So pressure support really is going to help him overcome that tube a little bit, so he's not having to overcome basically breathing through a bigger straw because we all have our whole airway to work with when we're naturally breathing, and he does not at this point because all he has is a tube. So even with him already having respiratory issues, it's hard to overcome breathing through a tube on your own. So a little bit of pressure support is going to give him a little bit of more, well, pressure and support to get over that small lumen of that airway. And pressure support, it helps increase the distribution of ventilation. It decreases work of breathing, decreases oxygen consumption, and decreases carbon dioxide production. So it's a very helpful tool when you're trying to start a weaning with somebody. So now that I've switched him over and got him on CPAP and pressure support 5 of 5, what I'm going to do initially is really coach and keep talking to him like, hey, you're doing good. Maybe slow down your breathing, try to take a deeper breath and make sure that I'm keeping him where he needs to be and that he's not feeling too much anxiety because it can be a stressful moment, but that I'm there with him and talking him through it. And if he does start to show any signs of increased work of breathing or diaphoretic, that I can increase that pressure support. I think I have a range from 5 to 10. So I don't really want to increase it unless I have to, and I'm not going to jump to 10. I might increase it, from 5 to 8 or even 5 to 6 if he's not showing all too much of stress, just because I want to help him pass that SBT and get his respiratory muscles working, but I don't want to do too much of the work for him because that'll make it harder in the long run for him. So after that, the ways to see if he's passed or failed an SBT. So signs that he's passed is his SpO2 is greater than or equal to 85 to 90%, or his PaO2 is greater than or equal to 50 to 60 torr. His pH is greater than or equal to 7.3, and then his PaCO2 doesn't increase more or equal to 10 torr. That his hemodynamics are still stable. His heart rate is not increased above 20%. He's not over. His heart rate's less than 120 to 140. His systolic blood pressure is less than 180 to 200, and then less than 90 millimeters mercury. And there's not a 20% change up or down. No vasopressors were required during it, that he's not on any vasopressors. His respiratory rate is less than or equal to 30 to 35 breaths a minute. And if his ref rate goes over that 35 breaths per minute for 5 minutes, then that is a failure. That his respiratory rate doesn't increase or decrease by 50%. We don't want that sign of that. So that's the signs that he passed, and then also the negative sides of those are signs that he failed. Other signs of failure is that if he has a change in mental status, onset or worsening discomfort, diaphoresis, signs of work of breathing. So this is primarily just a physical assessment, being in the room and watching him and seeing how he's reacting to this process, because you can do an SBT from 30 to 120 minutes, and make sure that he passes that successfully. So he does pass it successfully. He does very well on his SBT. I didn't have to increase his pressure support, and he's doing well. So prior to the extubation, the physician wants to do weaning parameters. So before I start any of those, I'm just going to talk to Mr. Rudd about what those are. So, Mr. Rudd, I'm going to do a couple of tests with you before I take that tube out, okay? You did really well through your SBT. This is the last little bit. So first thing I'm going to have you do is take a slow, deep breath, as big of a breath as you can. And I'm going to give you a moment to whenever you're ready. And so I would coach him through that and watch him just, and even mimic it with him, just like a, just as big as a breath as you can. Because what we're doing is there's getting a vital capacity, and that's going to measure how well he can take in an efficient, big, deep breath. Because a vital capacity, you want to get over 10 mLs per kilogram ideal body weight or over a liter. And for him, since he's 5'9", and his ideal body weight would be 59 kilos, 590 mLs or more is what I want him to get. So I'd want to measure that value. And after that assessment, we're going to do the MIP, which is maximum inspiratory pressure. So now, Mr. Rudd, what I'm going to have you do that you did well in that first test, and this is the second one, so the last one before we can get that tube out. So what I want you to do is suck in on that tube like it's a straw as hard as you can. Imagine you are been finishing a milkshake, you're at the very bottom, and you want to get every last bit of that milkshake as hard as you can. And I'll give you a moment to prepare and be ready. You let me know. I'll count you down when you give me a little head nod or indicate that you're ready to go, because I know that vital capacity can wear you out too. So then I would count him down. Okay, we're going to go 3, 2, 1 now. And then as he starts to do it, I would just continue to coach. Keep going, keep going, keep sucking in, get every last bit of that milkshake. You've almost got every bit. Make sure you get every last drop, and make sure that he is able to do that. So, and then after we get those two values, I would like to go over just some other normal values that you would want to see from him as well, since he is 5'4" and his ideal body weight. So again, the vital capacity, I'd want it to be over 10 mLs per kilogram or 1 liter, and that would be 590 mLs for him or more. MIP, we want to get more over to or equal to a -20 on that maximum inspiratory pressure, because what's that showing is that his diaphragm, his respiratory muscles are able to efficiently take in a big deep breath, and they're not so wore out that he can't even take these breaths, that there's some strength left in those. His tidal volume range would be 354 to 400 mLs. Respiratory rate, I want it less than that, 30 to 35 breaths a minute. Really, after he's done the SBT, I'd like it to be more less than 25, but less than 30 is okay as too. Minute ventilation, I would like it less than 10 liters per minute, but over 5 liters per minute, so he's adequately ventilating. And his Tobin index or rapid shallow breathing index less than 100. For SpO2, I'd like for it to be over or greater than 85 to 90%, but not at no decrease of 4%. I think he was already at 94 when we started, so I wouldn't want to see less than 90. Then PaCO2, I wouldn't want to see an increase of 10 or more or a decrease of 10 or more. And at this point, he did pass his SBT, and we're going to see if we can end the weaning parameters. So we're going to see if we can go ahead and get this tube out for Mr. Rudd in the next video.